I want to ask you, and I'm not going to make any correlation of UVB and COVID or anything there, but I want to ask you this from the pandemic. Do you think due to the pandemic that we are going to see a sudden maybe resurgence of looking back at things that may be able to help us for the next one, because this is not, let's be honest, this is not the only pandemic we'll ever have to face. This was not the only health risk we're still an incredibly sick nation and world. 50% or more of Americans are still, even when all this is gone, pandemic, are going to be chronically ill, many with infectious diseases that they can't kick. So let's not say that we're going to suddenly be all healthy once this pandemic's over. No, we may be worse off, actually, because we've been indoors.
I think we will be, actually. It's funny you mentioned that.
Yeah.
Part of our studies is we're looking with a West Coast Cancer Center to review the post-effects of COVID, because everybody says, well, I've had COVID and I'm cleansed. But the dilemma with COVID is that it coagulates the blood inside your body, and which in turn eliminates the functionality of those particular organs, your liver, your kidney, your lungs, your brain, for instance. And what we've noticed is that post-COVID patients don't get, and the primary thing is smell and taste. Mm-hmm. So you don't get your smell and taste back. Well, something affected that. Mm-hmm. The COVID did. Can we eliminate that? I'm thinking that the blood irradiation, and we're going to start trials beginning of next year to determine what we can do to help the post-COVID patients with their living and health and quality of living. Yeah. And I think we should be able to, but hypothetically it should help, but we don't know until we see the results.
Right.
Yeah.
Super interesting, right? Because there's so many applications of this. And to help people with something that is quite simple, you've done the technology, there's nothing, really radical that you have to do, has so few side effects, it just makes sense. Why wouldn't you? This is where I do have some problem with the medical establishment. If you're out of solutions, don't say, oh, well, let's wait for one. To that could be forever. We don't know sometimes, and especially when it comes to chronic conditions. Mm-hmm, we've been battling so many for so long, and they're incurable. Why not keep trying things from the past, from the present, from the future? That's
exactly right. And that's what we're doing. Yeah. You're doing it as well. We're doing it here and the other clinics. I've reached out, and I've got a campaign that will reach infectious blood-borne disease doctors, and I've had doctors send a lot of the patients to us here in our clinic in Raleigh. From word of mouth, I've sent out to the medical world here in the Raleigh area. And number one, I wasn't going to open here in Raleigh for a number of reasons. It's the 37th state of utilization of homeopathic and alternative medicines. We were going to open up in Arizona originally, but it was things led on other things, and I live here in Raleigh, so I felt it best to do it here. But we are seeing a tremendous amount of word of mouth coming from the medical world. So I've had pain management doctors send me several patients. I've had infectious bloodborne doctors send me some patients. So these are the doctors that care. Yeah. And I did notice there's a big difference in the ones that just are there and we're numbers to them, and the ones that are really caring. So, we're trying to reach out, and our objective, obviously, Casper, is try to help people, try to get them healthy, try to get them, because this procedure is simple. It takes some time, but it's a very simple procedure. It won't harm you. The worst thing it's going to do is make you feel better and alleviate some things that some of our patients didn't even realize they had until we got rid of it. Yeah. I'll give you an example. I had a patient come in. He's in his 60s, high blood pressure. So we're very good with blood pressure, by the way. Very good. And the reason for that is as the irradiated blood is going through your veins and eventually hit your arteries, it's cleansing it. It's oxygenating it. It's making it more flexible so those arteries and veins can collapse and depan according to your usage of the heart pump. And we've seen it. And he's an engineer as well. So he actually did a nice granular chart of when he came in, and you could see the decrementation of his blood pressure going down and down and down. But what I noticed is that it got rid of a cyst on his lung. And he goes, it was 5 centimeters. He goes, John, I went back. Doctor asked me what I did because it wasn't there anymore. I said, well, yes, we can get rid of cysts and we can get rid of tumors and inflammation. And thank God it helps. So these are things that we've noticed, is that the patients coming in, and I try to be personally involved with them as they introduce themselves, and I introduce the procedure to them. And what we're doing here, we call us a pilot clinic. And, I have an 18-page questionnaire that we get a ton of answers. A lot of the doctors don't care about what they eat and how they live and what time they get up. We do. We care about that, because that's going to be eventually database. And we're going to find out some things down the road, do the analysis, and hopefully we'll be able to help 100% of the people, which some of the scientists that are on our board have a feeling that we're going to be able to, with the calibration based off of what you guys, the NAD. That's a very interesting thing
I mean, listen, John, I can attest. I was the guinea pig for the PL 2020 for when it first came in.
Well, yeah, I heard about that.
Yes, and I ran personally a HeartQuest HRV assessment afterwards. And listen, autonomic nervous system was very balanced at that point. You saw improved mitochondrial function. I wasn't sick, so it's not a huge jump, but it was nuanced improvement that is many things don't do at all. I've done lots of therapies where you just go in and it was about the same. And, you saw this one a few days, 24, 36 hours after.
Good.
And you saw that improvement right there in a HRV assessment. So, I can say that. And we've definitely seen patients come in and respond very well. Above what we were seeing with a normal UVB, UBI treatment. So
yes.
So congrats on that. You really created something great here.
I thank you for being a partner with us.